So the first paper I'm going to talk about is Pulaski in 2015. This was a PhD thesis. This was one of the first papers to show this, but they looked at predictors of recovery from concussion in females specifically. We know that females tend to take longer to recover, and most of this has been attributed to a variety of things, which I've alluded to in previous podcasts. And if you want to check some episodes out, I think I did one called Boys vs. Girls and some other ones that talk about some of the reasons why females may take longer to recover than males. So this researcher wanted to examine a variety of variables in concussed females to determine some of the predictors for concussion recovery. So they looked at things like premorbid mental health conditions, neurocognitive issues, headaches, etc. They had 180 participants in this study, and they found that a delay in initial post-injury evaluation was the most predictive factor for having a prolonged recovery. I'll say that again. A delay in the initial post-injury evaluation was most predictive of a prolonged recovery. Similarly, Desai et al. In 2019 published a study in the Clinical Journal of Sports Medicine. They examined the differences between males and females in terms of their recovery trajectories following concussion. So this study was looking more as a comparison of males to females, and they looked at 192 people. Yes, females did take longer to recover following concussion than males. However, females also took 40% longer to come in for their first visit. So their time from injury to injury presentation or clinical assessment was 40% longer than males. They said the average time for assessment of males was 9 days, females was 15 days. So they're not getting in as quickly. Then, when they controlled for that variable, when they said, let's only look and compare males versus females for those patients that came in within the first 7 days after injury. And what they found was if they only looked at people that came in early on, the differences in recovery from males to females completely dissipated. So the conclusion here is potentially that maybe there isn't a difference in male to female recovery after all. Maybe the only difference is the fact that females tend to take longer to come in. So again, looking at time to injury presentation being a predictive factor of recovery.